The Vancouver Island Health Authority provides health care to more than 750,000 people on Vancouver Island, the surrounding islands, and mainland communities north of Powell River and south of Rivers Inlet. Close to 50,000 First Nations and Métis people who live in this region have access to VHA facilities and health services. In the next half hour, we're going to take a journey of discovery into the world of Aboriginal healthcare. We'll explore traditional Aboriginal approaches to health and well-being. We'll hear why centuries-old government policies and actions have created a multi-generational mistrust towards Western healthcare. And finally, we'll learn how healthcare practitioners can create an atmosphere of cultural safety through their own interactions with Aboriginal clients and patients.
As a student is a challenging concept. It's something that is not, it's not easy to describe. Clearly it's about building awareness, it's about building sensitivity, and ultimately about building competency. But it was, as I was reflecting on it, it's not something that you know, like there's never an end point. It's a continuous process. And it seems to me that it's one of those kinds of things in the world where somebody asks you to describe what it looks like or what it is, it's extremely hard to describe it, to put it into terms. But when you're in an interaction or a relationship and it isn't present, it's absolutely crystal clear.
For centuries, Aboriginal people have lived in the coastal regions and islands of British Columbia. Everything that the Coast Salish, Nuu-chah-nulth, and Kwakwaka'wakw nations needed to survive, from food to shelter to medicine, was found in the forests, lakes, rivers, and oceans. Aboriginal people continue to harvest plants and animals from the forests and sea for use in their diet, ceremonies, and medicines.
One of the reasons why we bring you here to this spot is because we want to show you all of the woods here. We have lived here for a very long time. European people have only been here for 150 years.
My name is Della Rice Sylvester, Hyamesiate from the Cowichan tribes on Vancouver Island in British Columbia in Canada. I'm from here by the river, by the Cowichan River, and I've lived here and grown up my whole life in the Cowichan Valley. I learned medicines and things at the feet of my grandmothers, running around the Cowichan Valley, getting medicines whenever they were needed.
The use of medicinal plants is widespread in traditional cultures around the world, but unlike modern medicine, traditional remedies often have a spiritual element.
Throughout my whole life, medicines, plants has been there. Plants as medicines and food as medicines has always been there, right? Always. Before I even came to live with my grandmothers, right? We lived on an island, and every day we had the cold bath in the ocean, right? And there was sand down there. Like I would not have known, except my mother passed this part of it on to me, right? And my mother always had sand in the house. Now sand takes the negative energy, right? Takes the negative energy. So sometimes I have the sand out in here, so if anybody comes in and a tizzy or whatever, you know, the sand will take it.
Many contemporary medicines were discovered by Aboriginal people and have been adapted for their medicinal properties by pharmaceutical companies. It is widely acknowledged that the traditional plants and medicines used by Aboriginal people around the world have healing properties.
A lot are taking Indian medicine and they tell me about it and I know about it, and there are times when it's important to know there can be contraindications with other Western medicines, but the first thing is not to be judgmental about it and not to say stop it, but to just gently find out what it is, how much they know about it, where did it come from, what are the medications that I'm prescribing, and just letting them know sometimes there can be interactions.
My great-grandmother, who was, I thought just my grandmother, was a healer. So I learned a lot from her. We used to go picking berries and bark and roots and things like that. And to this day, you still see the Métis people using these traditional medicines. They'll try traditional medicine before they go to a doctor, and you'll find some of them go to a doctor but not really trust the doctor and still use their traditional medicines at home.
A good doctor will tell you what's needed, and then you find out from the pharmacist that, hey, you can't mix this with something and you can't do this. And so, you know, there's a lot of stuff that has to be looked at. I mean, I don't know what we can do about that.
We're getting lazy, just going to the drugstore and getting prescription and not really walking in the woods and fixing our own and being healthy. And I think that's really what we have to address, and what we say when we walk in the woods, that's our life, our spirituality. Before Christianity, that was where we talk to nature, and then we treat them like human beings, and they look after us.
The relationship between Aboriginal patients and healthcare professionals is frequently hindered by cultural misunderstandings and differing views on healthcare and healing. This can lead to poor health outcomes for Aboriginal patients.
There are over 50 First Nations on Vancouver Island. There's also 6 Métis chartered communities, 6 Aboriginal Friendship Centres, and then also there's Aboriginal people that have come from other parts of Canada to settle on Vancouver Island. We know that culture can aid in the healing process. So the more the patient can access his or her cultural practices, the sooner that person will get to an optimum state of health. The other piece is that culture, being culture, is part of someone's identity. And it's important to recognize that if we're going to recognize the person as a whole person.
It is well documented that ancient Aboriginal people in North America were knowledgeable about their diseases and developed effective medical treatments for many of their illnesses. From these stories, we learn that traditional perspectives and approaches to healthcare have an important place in First Nation communities. The spiritual connection between the medicine and the patient is an important part of the healing process. This represents a significant difference between the Aboriginal perspective on healing and Western medical practices.
I guess traditional medicines, to me, was our way of life before. Because just to let you know, for my own self, you know, I was the last born of an elderly couple. I was the first one to go bear children in a hospital. My mother was a midwife, and all my other siblings were born at home, and my nieces and nephews. So going to the hospital too often is really new to me. You know, we had traditional medicines and for pregnancy, for after pregnancy. A lot of our cleansing medicines really kept our people healthy. And I think that's where we're losing a little bit right now.
Traditional methods and knowledge relating to the body, disease, and medicine are passed down orally from generation to generation and are awfully deeply connected with spiritual and cultural practices. When Europeans arrived in the Americas, they brought with them many diseases that were unknown to Aboriginal people, diseases which traditional medicines could not treat.
So there was a lot of diseases that weren't here that were brought. So you have to look at things which are indigenous to this continent and things that are not.
The 1996 Royal Commission on Aboriginal Peoples noted, although Aboriginal people have moved far away from the lifestyles of their ancestors, they still see value in the traditions and practices that made them unique, including medical traditions ranging from herbal therapies to forms of psychotherapy. Often they find that mainstream health services do not understand or fully meet their needs. Today, the perspectives of First Nations and Métis toward Western healthcare has been shaped by more than 150 years of interactions with government agencies. To many Aboriginal people, government institutions are synonymous with the loss of control regarding their health, education, housing, and finances.
I don't recall how I was taken to go to which I later discovered to be a residential school. That's where it all began for me. Of something, when I look back, and there's not happy at this. The number of years that I was there, I remember being picked up off the floor. I guess fainted or whatever, and what have you. And the next thing I know, I don't know how many years I was there, and then I was sent to a sanatorium.
By expanding your understanding of Aboriginal people and their historical and contemporary concepts of healthcare, you will learn how to build relationships that are based on cultural safety. This growing acceptance of a culturally safe healthcare environment is already resulting in improved health outcomes of Aboriginal people.
Probably you've heard from Aboriginal clients to a person that there are obstacles to their care. They've had previous experiences. They have knowledge of a system that has been neglectful to them, even downright hostile to them, that they've had healthcare professionals who've been careless and downright ignorant, some even racist, and we can say that, some who don't want to work with those populations, and that has curbed their trust. And so we need to bring them back in and say, please, you can and should be able to trust the hospital, clinic, doctor, nurse near you. They're interested in your health and well-being, and they can help. Because lots of times the client says, I'm not going to get help over there. They don't like us. I got treated badly there once. I had an experience where I think my being Aboriginal stopped me from getting good care. I don't believe in them. I think they're trying to push drugs on me. They're trying to boss me around. They think I'm stupid. You know, they have lots of excuses, sometimes good reasons for not trusting, but that has to change. They should be able to come and see us and get help.
As healthcare professionals, we are impacting the person to which we're in relationship with in the healthcare exchange, whatever that service may be, nursing, medicine, occupational therapy, social work, whatever. It's being in relationship with the client, the patient, understanding that they come with a story, a history, experiences that forms how they're going to respond to us as healthcare professionals.
What is needed to create a culturally safe healthcare environment? Healthcare professionals need to reflect on how they bring their own cultural biases and attitudes to the workplace, and ask themselves how this helps or hinders the creation of a culturally safe relationship with their patient.
In hospitals, where you find it hard is when you bring in elders and other people from communities, smaller communities, into a major center for health care. And we find in Alberta, Saskatchewan, Northwest Territories, they have people and liaisons and mentors that are there to meet them, take them to hospital appointments, doctor's appointments, hospital. They stay within one facility so they don't feel estranged. They used to feel locked in a hotel room and not be able to leave because they couldn't speak English. But now they're living in one. And I noticed in British Columbia you don't have that.
Working in emergency with all of the time pressures that come with that kind of work is probably an extreme example of what exists in a lot of our approach to healthcare delivery now. We're all very busy and we're on a very hurried time schedule, which in my experience doesn't work particularly well in terms of trying to make Aboriginal and other minority patients necessarily feel at ease, especially if they have language barriers and other cultural issues.
There is a correlation between the lower than average health status of First Nations, Inuit, and Métis and the historical relationship between Aboriginal people and the Government of Canada over the past 150 years.
Because we know from history that nobody really did give a damn. Their knowledge of history was abuse.
There are many aspects of Aboriginal history that continue to impact Aboriginal people today. The residential school system, the apprehension of children from First Nations families in the 1960s, and unacceptably high levels of poverty and poor housing conditions on many reservations adversely affects the ability of Aboriginal individuals and communities to pursue healthy lifestyles. The historical relationship between government agencies and Canada's Aboriginal people over the past 2 centuries has set the stage for poverty, poor health status, high suicide rates, abuse, addictions, and other personal and community issues facing Aboriginal communities. When Europeans arrived in British Columbia, traditional culture, languages, health practices, and spiritual teachings of First Nations were impacted. The settlers brought with them new cultures as well as new diseases. With no resistance, epidemics of measles and smallpox had high mortality rates in First Nations communities, often as high as 90% of the population in some villages. Traditional doctors and healers were overwhelmed with the rate of sickness from unfamiliar diseases. The smallpox epidemic of 1862-63 killed an estimated 20,000 Aboriginal people in British Columbia. For those who survived, it was difficult to avoid cultural, economic, and social assimilation. The Douglas Treaties on southern Vancouver Island, with the promise of access to health care, was used as a means to further assimilate Aboriginal communities. In the late 1800s, the Government of Canada contracted the education of Aboriginal children to religious groups and churches. This practice continued through the 1970s, with children as young as 6 years old removed from their parents and communities and sent to boarding schools for 10 months a year for most of their childhood. The schools were expected to provide children with adequate medical and dental care, but this was not always the case. Today, many Aboriginal men and women still carry the emotional and physical scars of their residential school experience, and this often affects their relationships with healthcare providers. In the early 1900s, the increasing health crisis amongst Aboriginal people led to yet another solution to the government's Indian problem. Indian hospitals were established to segregate Aboriginal people and address increasing healthcare demands in remote communities. In many cases, these hospitals and clinics were understaffed and undersupplied. They frequently were used to isolate patients from the general population during epidemics of TB and other diseases. Aboriginal people were often left at Indian hospitals, and their families and communities lost all contact with them. Today, when health planners examine the high rates of disease among Aboriginal people, they must take into account that the historical treatment of Aboriginal people in Canada has contributed to their vastly poorer health status compared to other Canadian groups. It is not surprising that the repercussions on Aboriginal health policies over the past century and a half have contributed to the mistrust, fear, and disempowerment that many Aboriginal people have towards the healthcare system.
My understanding of cultural safety is that it is a concept that has come out of New Zealand, specifically with the Maori nurses, and it has been created to provide a way to communicate and to share with others the exchange of care.
Cultural safety has been defined by the National Aboriginal Health Organization of Canada as what is felt or experienced by a patient when a healthcare provider communicates with the patient in a respectful, inclusive way, empowers the patient in decision-making, and builds a healthcare relationship where the patient and provider work together as a team to ensure maximum effectiveness of care. How do we continue to move towards a culturally safe healthcare environment for Aboriginal people? Each of us must reflect on how our own cultural attitudes can either help or hinder the foundation of a culturally safe relationship.
The biggest thing, and that would promote healing for the patients as well, is respect, and respect for family members, and kindness, and being non-judgmental, of course, in situations where sometimes judgment, you know, a judgmental comment can come out, or you know, it can be very hurtful. And as being an Aboriginal person at times, you take that probably more personally than the average person would.
Part of being culturally competent is being self-aware. In that, for instance, if you're a woman from a particular religious minority and I don't know anything about it, I have to say, well, I grew up in a certain way with certain beliefs and practices. They're different from yours, but I can manage my sense of differentness and help you.
Just showing compassion on who the person is, saying, oh, hi, Mrs. Delcall, so nice to meet you. I understand you're Métis, isn't that nice? It's just the acknowledgement, I think, and then puts the person at ease. And like I said, the big thing, having somebody else there maybe also. But for the nurses themselves and the doctors, it's acknowledging that person as being Aboriginal and speaking to them about it. And they're happy to tell you about it. They're happy to tell you their history. And it puts them more at ease. Like if you're interested, they feel comfortable with you. They feel that you're going to take a better interest in their health.
Well, one important issue that I think is important to bring out is that cultural competency runs in both directions. In that I, for instance, saw a young student nurse go into a First Nations community. She was young, eager, happy. She wanted to work with First Nations and do a really good job. And she went there and she saw this huge complexity of problems. Some people kind of butted up against her and said, you know, who do you think you are? What are you doing here? What's your business here? She wasn't, you know, as skilled as she was going to be 2 years later or 5 years later or 20 years later. You know, she's a young learner. We need those young learners. And so having her sit with me, and she cried and she said, people said mean things to me. I was frustrated by the difficulty of the patient care. There was no support, you know, in that there aren't a lot of workers in that arena to kind of bolster her along. And she said, you know, I feel discouraged. I wanted so much to help and I didn't feel like I could help. So discouraging that worker, slamming that worker, slamming any worker for their lack of skill and cultural competency is a terrible idea. You know, this young woman can't help being a young woman with not a lot of experience. She can't help that she didn't grow up in an Aboriginal community and that she's not Aboriginal. You know, she comes from a particular place, just like we come from a particular place. And so we must be understanding as Aboriginal people that there are people who are at various stages of competency, and we can encourage them along.
Our teaching is that you can't do things by yourself. You need help, and that's why we share everything, our happy times and sad times, so the person won't be alone. So hopefully in the future we can be a little bit more understanding of one another, I guess.
One of the ways that we're trying to better meet the needs of Aboriginal people is through the creation of All Nations healing rooms within new facilities that are being built by VHA. The All Nations healing rooms would be dedicated space that would allow Aboriginal people to practice their cultural ceremonies. Another of the programs that VHA has to better meet the needs of Aboriginal people is the Aboriginal Liaison Nurse Program. We have 8 Aboriginal liaison nurses up and down Vancouver Island, and their role is to work with the patient and to work with the patient's family to better increase access to services, to ensure that services are provided in a culturally safe manner.
The first process of healing by being cared for, the first result that leads to healing is that person that walks into the room to administer it. They look at you, I'm laying there, I look at you coming. I feel assured. My my well-being of feeling becomes enhanced because I now have faith in you. I now I give my life to your hands to help me solve what the problem is. So you are the, it's not the medicine, it's not the pill, it's not the IV, it's not that bolus hanging up there, so many drips. You know, it's not, it's that person that walks in, that initiates the first step leading to being well again. That's how critical it is.
Thank you for taking this journey of discovery. We hope you've gained some insights into the historical and contemporary realities that shape the relationship that we all have with Aboriginal people and how we can all benefit from a culturally safe healthcare environment.